Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hey, today is a great day. It is a great day to talk about ears and earwax. And many of you have been excited about hearing about cleaning your ears and what to do. And so we're going to get started with that. But I want to tell you, I'm so excited about, I went to San Leandro, which is in Northern California. It's right outside of Hayward, California, and Oakland, California area. And I happened to go there to get ready to go to church because I go to Glad Tidings International. It's about an hour and 45 minutes away, but it's worth the drive. Trust me, it's worth the drive with Bishop Jerry Macklin. So I go there, and it was a weekend, and we were just kind of, it was some people that decided from the church to get together. And after the event, I stopped to go to a grocery store. And when I was going there, I saw The Joint. The Joint is a chiropractic place. And so I was having a little problem with my back. And I usually go to The Joint. They have them all over the place. But the reason I'm talking about this one, I met and networked with the chiropractor there, Dr. Dancy. And Dr. Dancy has his own practice there in San Leandro in the Safeway parking area, the Safeway grocery area. So I want you all that are in the Oakland area, in San Leandro area, San Mateo, Hayward, those of you out there, if you would go and visit him, let him know that you heard about The Joint and his practice from Charlotte Johnson with Body in Balance. Charlotte Johnson with Body in Balance. I'm grateful for this networking. Now, today what we're going to do, I'm going to put on a video because I want to share the video that I shot while I was in the office. And so that I could show you in the clinic what type of equipment we use, and it makes more sense if you get a chance to see it that way. So we're going to do this in two parts. You'll hear about a 7-minute talk about the things that are in the office, and then we'll go through the slides like we normally do. So I'm going to go ahead and get that started. Let me add that. Removing wax from the ears. I'm going to show you some of the equipment that we use in ENT. Now, there are different ways that you can do it. If you go to your regular doctor, they're going to use something called flushing, and it's where they take a big syringe and they push that through the ear. So we're going to use this model here, and they will take and set a syringe here and flush water to try to force the wax out. The problem is sometimes that goes in, it'll flush it out, but when they flush, it'll hit up against the eardrum and make you feel like you are at Disney World or Six Flags and you didn't get a ticket. You will be spinning and dizzy and feel a little awkward. And so we don't do that in ENT, in the ear, nose, and throat offices. So I'm going to show you some of the equipment that we use. One of the things we do is here is our standard microscope. And this microscope shines a bright light into the ear canal. If you can see the microscope here, we lay the patient in the chair here. These go into the ear canal. So we're going to use this model because I could get me a volunteer to go onto YouTube. So we raise the chair up. And the speculum goes in, and your friendly ENT PA or nurse practitioner or physician will look through the microscope here, and when they do, they will see the wax and it is removed. Now, you can remove it in that manner, or you can remove it if, say, this is a busy area and you can't get in here, then you can always use your trusty otoscope here. Put this in, and when you turn the light on, it allows you to look with a magnifying glass. Now, you can't use these type. Probably when you're younger, you can, because you don't need so much depth perception. But when you become chronologically matured, such as myself, then you need the microscope so that it makes things bigger for you to see, because you're going to be using instruments. These instruments, I'm going to bring you a little closer and we'll zoom in. All right. So the first thing you do, you have your otoscopes. This otoscope is used for magnifying things and cleaning the ear. So this otoscope is used for cleaning the ear, and this otoscope here has what we give pneumatic otoscope. So you put this on here and you'll put a little puff of air in there. What that does is tell me whether the eardrum moves. So if I want to know if there's fluid in this middle ear, this section here, and I can't get that tympanogram as we discussed on the audiology video, then I would use the pneumatic otoscopy. Because if I've worked in third world countries before, and so they don't have all this equipment. When you go, like when I was in Jamaica and I did training, and we would do some medical training. We would go out and we didn't have all this fancy equipment here, so or the tympanogram. So we used the pneumatic otoscopy to see if there was fluid in kids' middle ear. Okay? What that does, you puff that air in there and you'll get movement of the eardrum. This area here, you'll get movement of the eardrum. All right, so let's talk about the types of suctions that we use. So we don't use flushing. We don't flash water in the ear. We use suction. And so what we do is we put this, I'm gonna go back here and get one of the suctions. This goes into a big tube. So I'll turn it on so you can hear the noise. It's pretty cool. And what it does, you put the suction on the end. Now you have 3 different types of suction sizes that you would use, and the size is the opening of the hole there. Turn that off. So the opening of the hole, you have a 7 suction, 5 suction, and a 3 suction. The closer you get to the eardrum, we use the smaller suction. You want to use a smaller suction so that you don't have as much pull on the eardrum. That would cause pain, and it also makes you dizzy. So we want to use a 3 suction closer to the ear. If you're in the middle of the ear canal, right about here, and there's wax close, then that noise is louder when the opening is wider. So you'll use a mid suction. And then we do the 7 for when there's a copious amount of cerumen in the ear and you want to get it out quicker. If you use the smaller diameter, you're going to take a lot longer time to get it out. We also have these instruments this one is a curette. It's called a curette. And this one is called a wire loop. You can see the difference. One's a smaller, nice size circle, and the other is a loop. So what you do is you go into the ear canal while you're looking through the microscope and you scoop out what you need, or you loosen it away from the ear canal. When you loosen it away from the ear canal, that tends to make it softer and easier for it to suction through with the suction there. So these are the instruments that we use to clean your ear. Hopefully that will help. We're going to talk a little bit more, and then we're going to get to see some of that ooey gooey stuff coming out of the ear. You'll enjoy it. All right, so that should give you some information about what we're going to talk about now, because now we're going to do what we traditionally do, and that's go through videos or slides. So we're going to be, again, this is talking about the maintenance of the human ear. Some of the things we're going to talk about, we already talked about a lot of the equipment, risk and danger of improper cleaning, and then when there's proper hygiene, what its point and purpose is. Actually, you really, well, I'll tell you later on, but really you don't even have to clean your ears. They're supposed to be self-cleaning. The thing is, there's certain skin types that people still have problems. So let's get it going. So earwax is actually there as a protectant. God knows what he's doing. He knew what he was doing when he designed us. He knew what we needed. And earwax is a protectant for the ear. So it's a natural barrier that traps dust and debris and bacteria and things like that. That's why when you go in your ear with bobby pins and rat tooth combs, and then you're using pins and other objects and paper clips and all of that stuff, when you go in there and start scratching your ear canal, all of those organisms that are stuck on that wax now have an entry, because our skin, when we talk about skin, I think we talked about that with the eczema. Now you're breaking that barrier. So when you break that barrier, things that were on the outside can now rush in. That's how you get outer ear infections, or what we call swimmer's ear. The wax in the ear acts like a lubricant to keep the ear clean and to keep it moist. Now, some people have really, really dry skin. And so if your skin is naturally dry, then you're going to have a lot of flaking and peeling. All right. The wax is a cleaner by taking out the dead skin that's there. So as you can see on the ear model here, look on the outside, the outer ear, the external ear, the auricle or the pinna. that outside area, that's the little flap that God just stuck on the sides of our head so that we could, I told you that's to funnel the sound waves into the ear canal. But that area can sometimes, on certain people, if you have certain skin conditions like eczema or you have psoriasis, that those dry patches will fall down, get mixed up into the wax, and then it makes it really hard. We'll talk about consistencies of wax. But the ear naturally cleans itself. So most of the time, wax is right at the entrance, right at the entrance. We know, even though you tell us, oh, I don't use any Q-tips. I don't put Q-tips in my ear. We know when you do, because if you look at this picture, you can see the yellow area. That's fatty tissue. That's fat. Earwax is not going to get past where that fatty tissue is because the ear canal has specialized oil glands, and that oil is what makes the wax. It keeps the skin from drying out. That's why you can't over clean your ears. Some people do too much cleaning, putting peroxide and alcohol and digging in there and scrubbing it with different objects. That you're doing too much. Like the kids say, you're doing way too much. If you do that, it changes the pH balance and the skin in this area, and it dries it out. Now, the fatty tissue area, that's what makes the oil. It's supposed to be there to cleanse the ear. Like I said, to help with, we talked about in the last slide. But what goes on is when you take a Q-tip, you push and you pull. So when you swipe, you push that wax deeper into the canal. There is no way that I should have to use a number 3 suction, like I showed you in the video, to suction wax from way down here by your eardrum. The only reason it's getting back there is because of repetitive pushing. Now, in defense of those of you that wear hearing aids or you use earbuds a lot, that's another thing that can push wax down in there. So it may get, earbuds don't usually get any further than right just into the entrance of the ear. But it should never get past where that fatty yellow tissue is. You see where the second white, that's a little cartilage. It should never get past to that second white cartilage. Okay? Absolutely, unequivocally not. Zero, no, nail. Don't do this. Do not use Q-tips. Whoever made Q-tips, well, you know what? We just got to, let's thank God. I'm going to thank God. All otolaryngology people will thank God for Q-tips because it is job security. You all using Q-tips, even though I have a circle and a red line through there, helps to shove wax into your ear, which gives me more appointments, which gives me more patient volume. So thank you if you're not going to listen to me. However, I wish you would. Just using a damp cloth on the outside of your ear is plenty. You remember when you were in elementary school, they told you don't put anything in health class. They told you that. In science class, they told you that. In gym class, they told you don't put anything larger than your elbow. Larger than your elbow. Now, nobody can stick their elbow in their ear. That means don't put anything in there. All right. Why? I'm not going to rupture my eardrum. If you knew the stories that I have had from people who perforate their eardrum. What's a perforation? Well, I'm glad you asked me. A perforation is where the eardrum, which the top left is a normal eardrum. The bottom left is a caricature of a ruptured eardrum. Now, eardrums can rupture from bad infections in the middle ear. They can rupture, but most of the time they rupture from somebody poking them. They can rupture when you dive at times, or you go really deep underwater. Sometimes that can happen. That's rare. What usually happens is somebody puts some type of object in their ear. I had a guy, he was saying he was being very careful, but his wife came into the bathroom. So his elbow was up by the door. And when she came in, she smacked his elbow and it shoved the Q-tip further into his ear than he wanted. And he had a nice rupture. Okay. So yes, you can rupture the eardrum with using Q-tips or other sharp objects. Here's some myths, some things that people talk about. Does earwax do your ears, and does it require regular removal? No, that's not true. It comes out on its own. Healthy ears will clean themselves. Now, there are some of you all that have very oily skin. So I'm going to talk about consistencies at this time. I'm going to stick that in. Caucasians, Asian cultures, Indian cultures, and Hispanic cultures tend to have drier ear canals, and the wax is hard and dry. So if it collects and there's not enough oil in the skin for that to slough off, yes, it can be very hard, and that's a little bit more difficult to get out. So if you're going to use anything, you need to use things like mineral oil or Debrox, and we'll get to that later on in the slide. African Americans tend to have more oily skin, and so there's more wax produced. And if you're producing more wax and you already have oily skin, then you're better off to use peroxide, which tends to bubble up and slough the stuff off when you take a shower and things like that. So, contrary to popular belief, no, you don't have to regularly clean your ears. Are there risks of cleaning the ears? Excessive cleaning of the ears can, yes, it can irritate and inflame the skin and cause damage by breaking the skin, which breaks that barrier, keeping out bacteria. That's how you can get fungal infections in the ear, and you can get staph infections in the ear. So if there's chronic itching, that's a problem, and that's usually caused from that. So when removal is necessary is when you can't hear. When you start to have your hearing affected, then you need to come in to see your friendly ENT and let us help you. Infections and complications of the ear, we're not going to be talking deeply about that, but you can get fungus, and you'll get like a furry white stuff that's in the ear, or you'll get some furry white stuff with black dots all over the tip of it. That's usually fungus. The white stuff that looks like cotton in there, and then when we suction it out, it starts oozing out. That stuff looks like, it just kind of oozes out, and it usually has an odor sometimes, causes the ear to itch really bad. That we have to treat with antifungals. The other thing that you can have is a lot of bacterial infection. That will make the ear swell closed. And when it swells closed, then there's wax that gets stuck in there, and we have to get all of that out. That's when you do really need medical attention. So some of the signs and symptoms is ear pain from infection. People that have eczema or psoriasis can have itching and a lot of dry skin, so we have to give you like a steroid, either ointment, drop, or we can use a steroid cream. If it's not deep in the ear, which we can look and see how deep it is, then we would use a steroid drop, oil drop, and that drop is called not Debrox. It's called dermatic oil. That you have to get a prescription for. Debrox is a cleaner, and you can get that over the counter. If your hearing starts to be decreased, if it starts to be muffled, you don't really lose a lot of hearing, but that would be when we talked about conductive hearing loss. This is something that would cause some mild conductive hearing loss. If you start getting discharge out of your ear. Now, discharge out of the ear is usually from an infection. That's not from wax. Okay, so we looked at the video and we saw all of these different objects. These are the otoscopes on each side. There is curettes, and then there's one real sharp object, and I usually don't let people see me coming at them with that because they get afraid. But that's a pick or a rosin needle that we use to try to remove the wax from the edges of the ear canal. Then that way we can put some drops of Debrox in there or mineral oil, and then it softens it up, and then the suction will just pull it right out like you saw on the little video. The other thing you can use is mineral oil. It's pretty cheap, and you can mix 50-50 of mineral oil and hydrogen peroxide and make you the Debrox. The microscope helps to make everything bigger for us to clean the ears for you. So, in conclusion, what I really want you to know is that really just using a face cloth and cleaning the outside of your ears so you can get all of the excess oil, and that you can get all of the dandruff or any scaly peeling skin from your ear canal or your forehead, your cheeks. Any of that will help to stop that from falling down in the ear and mixing with the wax. That would avoid a lot of complications. So for safety reasons, just use the face cloth, because using Q-tips can cause unnecessary damage to the eardrum and the canal. The other thing that I want you to know is, from a professional standpoint, you don't want to go to the regular doctor. They're going to flush your ear. You might want to just ask them, can you come to the ENT, where we use different equipment. And most of the time, it's rare that we make you dizzy. And also, using that flushing, it tends to cause you to get wet all over the place, so it feels like you've been at a water park when you're done, and especially in the wintertime. So you want to come see your friendly ENT and let us take care of you. I didn't think we were going to have the time for any videos of pulling things out, but I did show you the little short where the wax comes out with the vacuum. Hopefully this helps you and you have gained some knowledge on how to keep your ears clean when you need to come and see ENT. And this will let you know the instruments that we use. The point and purpose of this video today, one, was so that you all don't injure yourselves trying to clean your own ears. When you clean your ear, you're going in your ear with different objects that are sharp, long, pointy, dangerous, and you can injure your ear. You're going in there like Stevie Wonder. You can't see a thing, and you're just digging around in your ear. But if you let us clean your ear, we have large microscopes. I understand that chair lays down. You're going to be nervous because you just met that provider. You don't know much about them, but you are in a vulnerable position because you're laying down with your head turned to the side and a big old microscope and a loud sounding machine. That's why I turned the machine on so you could know what it sounds like. When the wax comes out of the ear, it sounds like just like that. Really, it does. It sounds like that. You'll feel something sliding out when it's a big ball. That is about the scariest part of it. We usually put a little bit if it's hard wax. Now, I'm going to tell you the best and most optimal visit is if you've gone to your regular doctor and they see a lot of wax and don't see your eardrum. Once you get your appointment, before you go to the ENT, put 3 or 4 drops of that mineral oil in your ear. Do it about 3 to 4 days before you go, and put the 3 to 4 drops in there at nighttime. Then put some cotton in there so it doesn't mess up your beautiful silk sheets, and pillowcases. But if you put that in there, when you come, the wax will come out a whole lot easier and you're not there as long. If you don't do that, there's going to be a lot of work. And if it's hard and dry, it's going to be stuck to the ear canal. So it's kind of like taking a Band-Aid off. It's better to soak it off than it is to just rip it off. So I would suggest you use the softening agents before you come, about 3 to 4 days before you come. Then for just plain old regular maintenance, if you have the skin types that I told you about, it's best you just put 1 drop of mineral oil once per week. Just once per week. You do not have to put that in every day. Otherwise, it's going to be real oily and then your ear is going to feel muffled again because of all of the oil that's in there. So just do 1 drop once a week to maintain the maintenance, and see the ENT doctors every 6 months. If you have a lot of wax problems and it collects a lot, then you should see them every 3 to 6 months instead of once a year. I want to say something to the people that have hearing aids. When you put the mineral oil in, make sure that you do it at nighttime. You put the 1 drop of mineral oil in at night so you don't ruin your hearing aids. All right. That is all that I have for you today. I look forward to seeing you all next week, Wednesday, on Body in Balance.